Welcome to today's webinar titled TRICARE Dental Options for You and Your Family. We are thrilled to have with us today Doug Essler with the TRICARE Dental Program, Gene Mays with the Active Duty Dental Program, and Gregory Banks with United Concordia. Without further delay, I will turn things over to Gene Mays.
Thanks, Stan. And hello, everyone. I'm Gene Mays with the Dental Program Office within the Defense Health Agency. I'd like to welcome you all here to today's briefing on the TRICARE Dental Program and the Active Duty Dental Program. We're going to get started with going through the mandatory disclaimer. The appearance of hyperlinks does not constitute endorsement by the Department of Defense of this website or the information, products, or services contained therein. For other than authorized activities such as military exchanges and morale, welfare, and recreation sites, the Department of Defense does not exercise any editorial control over the information you may find at these locations. Such links are provided consistent with the stated purpose of this Department of Defense sponsored webinar. Okay, with that out of the way, we can get into the agenda, and we're going to give a brief summary of the available dental options to you, go into more detail on the Active Duty Dental Program, and then we'll finish up with the TRICARE Dental Program. I'm going to slide 4. The dental options available to our beneficiaries include the Active Duty Dental Program, which covers active duty service members. And if you take a quick look to the next slide, also National Guard and Reserve members who are called or ordered to active duty for more than 30 days. That part is somewhat critical for those, as it has to be more than 30 days in order to get active duty dental care. And flipping back to slide 4 again, the second option is the TRICARE Dental Program, which is a voluntary dental program where the beneficiaries pay part or all of the premiums and is available to active duty family members, National Guard and Reserve members and their family members, and survivors. And then there's also for retired members, the Federal Employees Dental and Vision Insurance Program, which is a new program that started January 1st and offers 10 dental plans to beneficiaries that are eligible for that program. And that's about all we're going to say about the retiree dental options, as we're focused today on active duty dental and the TRICARE Dental Program. Okay. If we can go to slide 6 now, and we're going to focus on the Active Duty Dental Program for a few minutes. And it's available to active duty service members who must seek care from a dental treatment facility on a military base if they live or work, and that's key, live or work within 50 miles of the dental clinic. It's also available for those who live more than 50 miles away, although you'll be in the remote dental program. The Active Duty Dental Program is available to active duty service members who cannot receive the care they need from the dental treatment facility. In this case, if the dental treatment facility cannot provide the care you need, they will refer you out to a civilian provider, and with that referral, you can get the care you need. And it's important that you understand that the only care you can receive is what is included on the referral notice. And to receive the civilian dental care through the Active Duty Dental Program, service members must receive a referral to a civilian dentist from your military dental clinic, or if you're in the remote program, live and work more than 50 miles from a military dental clinic. The Active Duty Dental Program is administered by United Concordia companies in the United States and the U.S. territories. If you're stationed overseas in a remote location, then you'll get dental care through International SOS. In our next slide, if you need care under the Active Duty Dental Program, you must get an appointment control number from United Concordia. This will happen in a couple of different ways. If you're referred to the Active Duty Dental Program by a dental treatment facility by a military dentist, the dentist should give you a referral request confirmation that will include the appointment control number. It's only valid for the services specified in the referral confirmation. And the important thing to note is, no matter where you live, civilian dental care is not authorized until you receive the appointment control number from United Concordia. For members living in remote locations, again, living and working more than 50 miles from a DTF, there's a couple different ways you can get the appointment control number. You can call United Concordia at the phone number listed there and request one, or you can go to the website listed there and request an ACN or an appointment control number through the web. If you're a remote member, once you receive the appointment control number, you can go ahead and make your appointment for care. And at this point, I'm going to ask Mr. Gregory Banks from United Concordia to discuss your options for making appointments and receiving care. So, Mr. Banks?
Thank you, Gene, and good afternoon, everyone. Again, my name is Gregory Banks, and I work with United Concordia. And I'm going to talk to you about some specific aspects of the active duty dental program. And first of all, is making an appointment. And like Gene mentioned, the most important thing to remember to have an appointment control number. And you can receive those appointment control numbers through three different methods. One, and the most efficient, would be online at our addp-ucci.com. If you go online, you will receive an immediate appointment control number. Another way to do it is through the referral process by our military dentist. They can go in and they can schedule the appointment for you and present you with the appointment control number. And for those members that are scheduling their own appointment, like Gene, generally those are the members that are classified as remote, that live and work at least 50 miles from a military treatment facility. They can go online or use any of the other two processes, to get an appointment. Or if another aspect would be for our reserve component members who are on their transitional assistance management program that are listed as remote. But again, the most important thing to remember is to make sure that you get your appointment control number, or at any point during the process, if you have difficulty or you need support, you can contact our customer care dental finders at 1-866-984-2337. And they can help you schedule an appointment. And that's for routine care. For any specialty care, for example, crowns, bridges, dentures, or periodontal treatment, that requires an authorization. And that authorization process is handled through our network dentist, which we'll discuss. Slide 9. As far as the covered services and benefits, all of that information is listed on our website. Again, www.addp-ucci.com. It'll provide you with all the covered services, what the limitations are, the exceptions and exclusions. And I encourage everyone, if you're using the program, to be able to go on there and look at your covered benefits. Now that I've talked about those, I'm going to turn it over to Doug, and Doug will talk about some of the specific information on the active duty dental program. Doug?
Thank you, Greg. Hi, everybody. And I just want to say thank you for attending this briefing and the benefits encompassed within this particular program. Like Stan had mentioned at the beginning, I am Doug Elsesser, and I work in the dental program office at the Defense Health Agency as well. So I'm going to brief on slide 10 a little bit, and I'm going to turn it back over to Greg, and then I will wrap up at the end as well. One thing about the TRICARE dental program is that it's a great benefit in that it's voluntary, you can choose it, and have the benefits available to you, whether you live in the United States or outside of the United States. So this is a worldwide benefit that is eligible to all active duty family members, any National Guard and Reserve members, along with their family members, and any survivors as well. In order to become enrolled into this program, one of the biggest things that we always utilize within not just dental care, but even on the healthcare side as well, is what is reflected based on your status in the DEAR system. Remember, the Defense Enrollment and Eligibility Reporting System are the tools that we utilize to see whether or not somebody would be eligible to gain any of these benefits. In order to be eligible for a TRICARE dental program, the sponsor must have a minimum of 12 months remaining on his or her military contract in order to be eligible for enrollment in a program. If that time frame is under that duration, then unfortunately folks would not be eligible to be able to sign up for this particular program. So what I'm going to do now is I'm going to turn this back over to Greg, and Greg will discuss the different nuances of enrollment, payments, and covered benefits along with this program, and then I will come back at the end to wrap everything up. So thank you. Greg?
Thanks, Doug. On slide 11, we're going to discuss enrolling in the TRICARE dental program. The three methods of enrolling are the same as the active duty dental program. You can do it online, which again is the most efficient. You can do it by mail or on phone. As a note, only the sponsor or the sponsor-appointed individual with a valid power of attorney can add a family member. And family members at age 18 and older may update their own contact information. Enrollment is done through the beneficiary web enrollment website, and the website is listed there. And once you enroll, all eligible members must be enrolled, except children under the age of 1. And if they're under the age of 1, you can voluntarily enroll them at that time, or remotely located members. Voluntary enrollment is allowed there as well. On slide 12, getting care through TDP. When using a network dentist, you should never pay. The TRICARE dental program is structured similar to TRICARE Medical Select, in that it's a preferred provider option, which means that you can go in-network or out-of-network. That option is available to you. But when using a network dentist, you shouldn't have to pay any applicable cost shares for covered services. And the dentists have signed an agreement with us stating that they are network providing dentists. In addition, to find a network dentist, you have an option. You can go on our website, and there's a Find a Dentist application, and you can put your zip code and a mile radius, and it'll populate with all the dentists within our network. Or you can contact our customer care finders through the TRICARE dental program, and we'll be glad to assist you in it. The number for that is in CONUS is 1-844-653-4061. Slide 13, in addition, we're talking about the non-network dentists and what non-network dentists can do. Just the bottom line for you, for the non-network dentists, they bill up to what our costs are, and they can balance bill you. So we encourage you to use network dentists. And again, feel free, and we encourage you to utilize us to help you find a dentist within the network. Slide 14, for OCONUS, the TRICARE dental program is CONUS and OCONUS. And the OCONUS services are included areas not in the CONUS area, and covered services provided aboard a ship or a vessel outside the territorial waters of the CONUS area, regardless of the dentist office. You may visit any OCONUS dentist to receive care. However, it's more convenient, of course, and more cost-effective to use a TRICARE dentist preferred, OCONUS preferred dentist, which we term as TOPDs. And they're not required to pay their full coverage at the time of service and only require the applicable cost share. Again, any information that you have or you require for the TRICARE dental program, our websites are available for you. In slide 15, we're talking about the covered services and the cost shares. Our cost shares for TRICARE dental are broken up between E1 through E4 and E5 and above. And the percentages that you see on the slides are the percentage that you are responsible for. The total covered benefits, again, are covered on our website. And on slide 16, it further talks about our covered services to include orthodontic care. And for orthodontic care, the age for spouses is up to age 23. And for family member children, it's 21 if they're not in college, or 23 if they're in a full-time college. And slide 17 for the premium payments. Again, the premiums are based upon the sponsor and the amount. Our contract year changes each May 1st. The payments, once you enroll, it's required that you pay the first month's payment up front. If it's online, it can be done by credit card. If it's by mail, you can mail it in. But the payment options, the first month payment is due up front, and the contract is for a 12-month contract year. And as Gene mentioned, that there's a retainability of 12 months for sponsors to have to be able to enroll in the program. And slide 18 talks about our TDP Wellness Program. This program we brought on because, as research has shown, that holistically what goes on with us systemically in our bodies affect us orally as well. So we brought the TDP Wellness Program on that if any of these conditions affect you and or your family members, you can enroll. The enrollment is done in My Account, and we'll talk about My Account on the next slide. Another addition to the program that we've added is for special needs. And if a family member is identified as special needs, nitrous oxide is covered 100% when using a network dentist. On slide 19, it further discusses about the TDP Wellness Program, and then it mentions about the My Account. You can log into My Account by visiting our website again at www.uccitdp.com and clicking the login on My Account button on the top right of the screen. You have to have a DS logon and password, and the DS logon must be a level 2 or premium account. In addition to the TDP Wellness Program that you'll have access to with My Account, you can also do your claims and account specific information, get that information, do online bill payment, find benefit information, and again, importantly, enroll yourself or your family if any of these conditions, TDP Wellness registration conditions, apply. On slide 20, it actually shows how the My Account page, if you notice the red box up top that has log into My Account, as well you can see on that landing page there's a savings estimator. In the savings estimator, you can actually go in there and put information in there about the procedures that you're getting, and it can tell you specifically what your out-of-pocket costs will be. I encourage you, if you're in the TRICARE dental program, to utilize My Account. At this time, I'll turn it back over to Doug.
Thanks again, Greg. Great information. Appreciate that. On slide 21, this is something that I had mentioned a while back when I was talking, and this is the importance of keeping your DEERS information up to date. As a military retiree myself, this is something that I constantly emphasize to friends, to family, to members, that everything that we do in determining your eligibility for care is based on what's in DEERS. A lot of folks only update their DEERS, or they look at their DEERS when they are getting ready to PCS or whether they need a new ID card. And these resources are at our fingertips now. So if we go online or go to an ID card office, we can check this information on an annual basis. And that's just my recommendation, to ensure that your phone numbers are up to date, that your address is up to date, and that all your information is current. You can do that online. You can contact the telephone number that you see there. You can even provide updates via a fax. And so that information is all available. At the bottom, you see the website, which will direct you or link you through the TRICARE website and into that DEERS information. On slide 22, as we progress, we identify all the various websites. Now, it looks like that there's a lot of websites there, but it's really two two programs. So you have the active duty dental program and you have the TRICARE dental program. Both websites are annotated there that will direct you through the main TRICARE website, which if you haven't utilized or looked at the TRICARE website, that's always beneficial. Everything pertaining to TRICARE information can be found in that website with a link as well to the dental programs and their information. Or there's also the direct websites to United Concordia, one for the active duty dental program and one for the TRICARE dental program. Within these websites, there are so many tools to utilize. The benefits booklet is in there, so if you're not sure whether something is covered or not, you can find that information in there. If you want to find a provider, that information is in there. If you want to just get different information on how the program works, or like Greg had mentioned, on going into your personal account, or trying to find out information on the healthcare or wellness program, that information is in there as well. So we constantly emphasize utilization of these websites, because a lot of times folks may try to reach out to TRICARE or to Concordia or some of these different agencies that have customer service reps. And a lot of times that may take you a lot more time than if you had just gone into the website to garner the information that you are looking for. So at this point, this concludes our information brief. I'm going to turn it over to Stan, and Stan will provide you information on how to ask us any questions that you may have. So thank you for your time. Stan?
All right, thank you. Let's see here. We do have some questions that have started to roll in. First question reads, are retired active duty military eligible for TRICARE dental and vision?
I can answer that. This is Tammy with Delta Dental, and in order to enroll in dental and vision, you must contact benefits. They are the enrollment contractor. Their number is 877-888-3337. Their website is www.benefeds.com.
Thank you. Let's see. Next question reads, I'm using an in-network dentist for myself and my children. They frequently charge our family a copay for service, even fillings. Based on what was just explained, this doesn't sound right. Can you explain?
There is a cost share for restorative care. And that cost share is 20%. If it's in-network, there is a cost share for restorative care. It depends on specifically what type of restorative care you're speaking of. If you give me specifics, I can answer to that specifically.
Okay, thank you. Next question, does the sponsor, military retired, have to have TRICARE Select before spouse is eligible for dental and vision with TRICARE? Spouse is 65 years old. Would spouse have TRICARE for life?
This is Doug. I can kind of answer a portion of that. One thing to keep in mind is that TRICARE for life and the TRICARE Select and TRICARE Prime are healthcare benefits. So they have no bearing on the dental benefits that you may be eligible for. So if someone were a retiree, like Tammy had mentioned before, they can actually go to that benefits website through OPM, the Office of Personnel Management, and seek a different, one of the 10 different choices.
Okay. Tammy, real quick, can you repeat that website, please?
It's www.benefeds.com. Benefeds.
Okay, thank you. The next question, if you have a qualifying event, job loss, can we sign up for dental mid-year?
Yes, you can. You have 60 days from a qualifying life event to sign up for dental within that 60 days that you qualify.
Okay, next question reads, is there a way to get the care card number for an ex-spouse who is active duty when there is no contact with him or branch of service and the parent doesn't want to have contact?
This is Francine from customer service, and I think the question is a little bit maybe confusing, and that's why we can't readily give an answer. It would be first, the sponsor, whomever is the sponsor, has to actually sign the child up for the TRICARE dental program benefit. And if there is an estranged relationship between the parent that maybe has custody of the child or is maintained in that home and the sponsor, it becomes problematic. The only thing would be is, and I guess TDP helped me on this maybe, is whether or not there's a power of attorney that would allow for that, but even then I'm not sure that would work.
Right, Francine, this is Doug, and that's a good point. Francine is correct, and we do on occasion deal with circumstances like this, and what we recommend oftentimes is that if the children are enrolled and that ex-spouse is not able to gain access to information that the care that the children are receiving, that they can actually reach out to United Concordia directly and communicate with them. And in certain circumstances, they may have to provide that power of attorney, or they may have to provide court documentation like the divorce decree or something along those lines that would identify perhaps what level of information that other divorcee is entitled to. So it's kind of get into some of the legal aspects of that, and it can be kind of confusing. So those are some of the routes that I would recommend.
Okay, thank you. The next question reads, because it's so new, you should probably make it clear that TRICARE no longer provides dental plans for military retirees. Dental coverage is now available through FedVip, which is administered by Benefeds. So I guess that wasn't a question, but a statement. Okay, next question. I was married 28 of 30 years of my husband's active duty in the Air Force. We were divorced 5 years after retirement, and I'm currently entitled to TRICARE and commissary and exchange privileges. So am I eligible for dental?
This is Francine. When you're in years, do you show as an unremarried former spouse and access care under your own Social Security number? Because that's going to impact, and so you would need to contact Benefeds and let them know that how you are actually, it sounds like you probably do, tell them what your circumstances are, and they would then make that determination as to whether or not you could enroll under their plan. Benefeds, do you have something you want to say?
This is Gene. Just as a follow-up on that, divorced spouses are not eligible for retiree dental, either under the old TRDP or under the new FedVip program. And that's by the way the statute defined the program.
Okay, I guess I'm going to go on to the next question. As a retired Air Force member, I'm enrolled in the federal dental program. Is there an additional premium for vision care, or is it automatically included with the dental premium?
No, this is Tammy. You have to pay a separate premium for the vision. They're completely separate.
Okay, thank you. The next question, this is, what if they meet the 2020 rule? I guess that was in relation to one of the other questions earlier.
This is in regard to divorced spouses being eligible for dental care after the member has retired. By statute, ex-spouses are not eligible for dental care under any retired program for dental.
Okay. And it looks like we have another question. During TAP, who is covered? Meaning, does the NGR member have ADDP for the 180 days, and the family member gets covered from TDP by paying for it as family only without paying for the sponsor's coverage?
For our National Guard and Reserve members, they're eligible for TAMP if they've deployed for 30 consecutive days for contingency, and that's for the service member. The family is only entitled to TRICARE Dental if they've already enrolled. And again, the TRICARE Dental program is a voluntary program, premium-based. So dental isn't included for family members when service members receive their TAMP. They have to already be pre-enrolled. The only difference is if it's for contingency and for 30 days, during that TAMP, during the activation of that member for the contingency, and before their terminal leave begins, there's a 60% subsidy that the government provides for active duty service members, and they're entitled to that as well. And just to follow up to something non-related, I forgot, for the enrollment for the TRICARE Dental program is by the 20th of the month, the same as TRICARE Medical. If you enroll before the 20th of the month, the plan is eligible. You're eligible for the plan the following month. After the 20th of the month, it's the month after. Thank you.
Thank you. Okay. Looks like I have cleared out the question queue, and there are no other questions that have come in. So I'm wondering if Gene, Doug, or Gregory would like to close with anything before I conclude the webinar.
This is Jane. I would just like to thank everyone for attending and listening, and for the questions you submitted to us. And hopefully we provided some information that you'll find useful. Thank you.
All right. Well, we do have one other question that just came in. It's pretty... Okay, let me read this question. My wife is Chinese and lives in China. I have active duty stationed in Italy. She was not eligible for command sponsorship due to only 10 months left in service. She is not command sponsored in China, so we only have one choice of coverage. There are no TDP dentists in China. We understand the claim process, and we paid out of pocket for everything and submitted the claim. After translation of the files and the check was supposedly sent, when can I expect the payment?
This is Greg from United Concordia. I'd like to research that. As far as what the eligibility, if there's only 10 months retainability, if they're already in the program, and the such. So I'll need a little more additional information.
Okay, we can make sure that we get that question over to you.
Yeah, and I'll provide my contact information to you to provide to them. I'll email it to Karina right now.
Okay. Well, at this time, I would like to thank Gene, Doug, and Gregory for sharing the information related to this topic. I would also like to thank our attendees for participating in today's webinar. If we did not answer your question today, please refer to the contact information in your copy of the webinar slide deck. Also, you can find many of the answers to questions about TRICARE benefits on the TRICARE website at tricare.mil. This concludes today's webinar on TRICARE dental options for you and your family. Thank you all for joining and have a great day.